Hi, I'm Dr. Jason Olitsky. I am the Clinical Director of Photography and Aesthetics with the Clinical Mastery Series. And my tip today is whether to shoot in TTL mode or manual mode when utilizing your camera for clinical photography in the office. And which one should you do? Both can be right. It just depends on your comfort level of how you want to shoot. TTL means through the lens metered, which means your camera is using internal metering to determine how much light it needs to properly expose an image. And that could be flawed in some instances. As many of us know, when we shoot with black contrasters, many times the image will come out a little overexposed and we'll have to recompose and shoot that image again to get a properly exposed image. Also, we may not have as much consistency shooting picture to picture because of the camera's exposure may be compensating one way or another for each picture. So you may not have exactly the same exposure every time. However, all those things aside, it is the simpler way to shoot. So somebody who's a novice in photography or just learning would rather shoot in TTL mode because it's just easier to do. Now, to shoot in manual mode, you will get more consistency from picture to picture as far as exposure is concerned. Now, the downside is that you have to understand how to control exposure in a camera, understand the way that shutter speed, aperture, and ISO work together with flash output in order to get a properly exposed image every time. If you understand those fundamentals, such as the exposure triangle, then you can shoot in manual mode and you'll have a little bit more consistency from picture to picture. So in Seattle, with the Clinical Mastery Series, I will be there teaching a day-and-a-half photography course on clinical and portrait photography. And we'll talk about some of those fundamentals, and you can decide which will be right for you, shooting in TTL mode or shooting in manual mode. I hope I see you there.